Hi, my name is Dr. Vera Tarman, and I am an addictions physician working out of Toronto, Canada. Today, I want to talk about the drug ketamine. Ketamine is a medication that's used for anesthesia and pain relief. It was actually developed in 1962. Because it has a medical purpose, it is on the World Health Organization's list of essential medications. But a lot of us know it as a recreational drug, sometimes a drug of abuse. Let me tell you first about the medical uses, because I actually want to focus more on the recreational and addictive uses. It's a local anesthetic. It can be used as a IV anesthetic for surgery. It can cause short-term pain relief, maybe an hour or two. You can put it topically on your skin. It's often compounded into medications, or you can use it as an injection. When it was introduced in the 1960s, 70s, it was a veterinary drug. It was used for animals, but we're using it more and more now in the human population. Like you'll see it in the emergency, even in a family doctor's office, and certainly with surgery. There's been more emphasis, more interest now in looking at it from a mental health point of view in terms of, can it help with depression? Can it help with post-traumatic stress disorder? Now, the reason why it might help for depression and post-traumatic stress disorders is because it does actually have an effect on mood. It can heighten mood if you're using it at specific doses, finding that sweet spot of where it can cause not exactly euphoria, but a heightened mood. That might be helpful for somebody who's suffering from depression. A post-traumatic stress disorder, it does have an effect on memory in the context of post-traumatic stress disorders. A person is usually burdened with terrible memories that disturb them. It may be a useful way to blunt the effect of those memories during therapy. This is experimental. Interestingly, it's also being talked about as a possible treatment for alcoholism, opiates, and cocaine addiction. Again, this is all experimental. I'm an addictions physician. I know ketamine from the recreational point of view. I've heard about it a great deal, especially in the 80s and 90s when people were going to raves. It's considered a classic club drug, and it gained a lot of popularity in the rave scene because it had a euphoric effect as well as a dissociative effect. And unlike a drug like MDMA or Ecstasy, which was a stimulant, this was a depressant. Would give you the euphoric high, but it would also be a downer. It's often compared to alcohol. So where do we see recreational ketamine use? It's not as prevalent in the US and Canada as it is in Asia. In the US, it has increased from a very low amount of 0.03% in 2006 all the way up to 0.13%. But that's not even 1%. Let's compare that with alcoholism, where we're talking about 10% of the population. It's more common in males than females, and typically it's seen most often in ages of 8 to 25. About 25% will develop a ketamine addiction. So let's talk about what it actually does, both medicinally or recreationally. The first thing is it does give a feeling of euphoria. It can actually induce feelings of happiness and a floating sensation. This might be useful if a person is suffering from physical pain, but also some emotional pain. Perhaps because of the euphoria, it may also have an antidepressant-like quality. Now, what's unique about ketamine is it gives a sense of detachment from surroundings, what we call a sense of dissociation, even a detachment from yourself. People will describe that they feel like they're watching themselves. They're actually not themselves, they're watching themselves. If the person has had a high enough dose, that sense of dissociation may actually lead to hallucinations, visual, auditory, and tactile. So a person will actually feel that they're outside of the realm of reality. In this way, ketamine is seen as a psychedelic. That might be the reason why somebody would choose ketamine over another drug. So let me say a little bit about the K-hole. Ketamine is a dissociative psychedelic. If you take too much of it, or you take it in a context where you can't control the environment, negative things are happening, you're worried about something, you're anxious about something, you can actually lose control of this dissociative effect and get what's called a K-hole. It would be probably equivalent to somebody who uses LSD and says, I had a bad acid trip. What is a K-hole is it's an immersive dissociative state filled with vivid hallucinations, distorted body sensations, a profound sense of detachment from surroundings. If it happens to be a good trip, then some people will say actually feels blissful. The people who are often drawn to ketamine like this dissociative, blissful, floating feeling better than something like LSD, which is very stimulating, and you're chewing and you're biting and you can't eat. It's a very stimulating drug. Ketamine is like drinking, but you get some of the effects of a psychedelic experience. However, in later days or more as the use becomes higher, you end up having lesser control, and these K-holes can actually be quite terrifying. People are introduced to it in the rave scene, and then they start using it on their own. Forget about the parties, forget about people, and now they're using it on their own. When that happens, usually there's an addiction pattern that's starting to form. It's actually very much alcohol, and we as physicians treat the withdrawal and some of the actual manifestations of ketamine high the same as we would with somebody who's drinking or is in an overdose from alcohol. It causes impaired motor function. Just like somebody who's drinking can't drive a car because they have difficulty with balance, with coordination, with eye motor coordination. They can't respond quickly when in a car, even though it has an antidepressant effect in early days, that euphoric effect over the long term causes depression and even suicidality. Same as alcohol. If a person takes enough of ketamine, like alcohol, you can have an overdose and die. Alcohol overdose is potentially fatal, so is ketamine overdose. Like with alcohol, you can have memory loss, what we would call a blackout. So short-term memory loss, and it can even affect long-term memory. The backstory, why is this actually happening? Ketamine is binding to the NMDA receptors, which are involved with learning and memory. It's these receptors, when affected, that can cause the dissociation and hallucinations. Like with all drugs of abuse, it increases dopamine release, then has the strong potential of leading to addiction. It affects the opioid receptors, and that's where our pain can be subdued with this drug. It acts as an anticholinergic, much like Gravol does. Actually, a lot of antipsychotics do, a lot of medications. Anticholinergic effect makes you tired, sedated, dry mouth. Think about Gravol. You have to go to the bathroom, but you can't, like you're constipated or you're unable to pee when you have to. I've been comparing it to alcohol. It does affect the GABA receptors. The GABA receptors is a really important piece. Probably why ketamine is addictive. You have a withdrawal pattern when you stop, and it's got to do with the GABA receptors. GABA is our neurochemical that slows us down and helps us sleep and helps us feel relaxed. And that's what ketamine does. It has a very quick tolerance level. I don't need to take very much alcohol or a benzodiazepine, which goes with the GABA receptors as well, or ketamine before I become tolerant to it. And therefore, if I stop using it, I feel unsettled, anxious, insomnia, not wanting to eat, just feeling overall very uncomfortable. Whenever a drug enhances dopamine beyond the normal capacity, beyond what our mind can tolerate, we eventually develop a tolerance. When you develop a tolerance, that means you need more to get the same effect. The body is saying, no, you're having too much of that. The dopamine is too high. But you're saying, well, I want that high feeling, even though my brain doesn't want that. I want that. I become tolerant to the more, and then I need to have even more, and I become tolerant. All the while, as I'm upping my dose, I'm starting to develop impairment. And the impairment can be to the point where the drug amount is so high that I become comatose. That's how overdose can happen. I've mentioned the rave scene. Sometimes people, when they go to raves, aren't just taking one drug. Often they're taking MDMA or ecstasy as well. Or they start with ecstasy, find that they don't really like the stimulating effect, or they want to have more of a psychedelic effect. They mix the two of them together. What's the difference? Ketamine, NMDA antagonist, which has this dissociative effect. Whereas DMA, not to be confused with NMDA, let's just call it ecstasy, is not a dissociative experience. It's more of a connected pathic feeling. It enhances serotonin. Serotonin is our neurochemical of connection, of safety, of feeling I don't need anything, I'm just happy all the time. It's not an excited thrill feeling, it's more of a connected feeling, although it is stimulating, as opposed to ketamine, which is a sedative. Ketamine is often snorted or injected, and ecstasy is a pill. Ketamine is short acting, it's 1 to 2 hours, whereas ecstasy can be 4 to 6 hours. It can be mixed together. Often people will want the ecstasy connection, but they want the ketamine to relax, and then they'll probably go off on their own, because ketamine is often a drug that people eventually want to be on their own, just like alcohol. Alcohol is a very social drug, but later days of addiction, people are usually off on their own. Now I want to just spend a couple of moments about a pretty serious condition. It's like every drug has its issue. Alcohol has liver, cocaine or crack use has lung issues, COPD, and psychotic issues. I mean, it is the bladder and the urethra, otherwise known as ketamine cystitis. Chemicals in ketamine are toxic to the bladder. It's so common that when somebody tells me that they have an addiction to ketamine, I say, how is your bladder? Are you peeing blood? Are you feeling like you have a constant urinary tract infection? Are you cramping as if you have a urinary tract infection? It's very painful. Of ketamine cause inflammation in the bladder. It actually erodes the bladder lining. That is in itself painful. And this is not because there's an infection. Of course, when you've got constant inflammation in the bladder, not only does it feel like a UTI, it might actually become a UTI. Your bladders become vulnerable and can't fight the bacteria as well. So that people with ketamine cystitis also have frequent urinary tract infections. Chronic ketamine use actually causes neurological changes to the bladder. The bladder holds the urine, and it's the urethra that you use to pee out the urine from the bladder. And both of those require fine motor movements. Squeeze the bladder to pee it out. That ability to squeeze, you can't pee. You end up with a full bladder, and that's extremely painful. The bladder can actually become flaccid. Unfortunately, people actually have to get their bladder removed, a cystectomy. It can be that bad. In summary, from a medicinal point of view, pain and aesthetic qualities, which are good. There's some thought that it might be able to be used for mood disorder and PTSD. But on the recreational front, it is like alcohol in its sedative effect, its withdrawal, its addictive effect. And it can cause some of the same consequences of long-term alcohol use. For example, motor impairment, memory loss, depression, oversedation. Finally, ketamine cystitis. Unique to ketamine is effect on the bladder, which just gets worse. If you stop at early days, can recover quite nicely after a few months. But if you continue to use it, you can actually lose the functioning of your bladder and then have to have it removed. So of the party drugs, if you were somebody wanting to use drugs, I'd use it very carefully, being aware of the high potential 25% of addiction, and also for the long-term impairment, which may not actually be recoverable. And the lure of the drug, the excitement of the drug, the actual experience that you enjoyed will not last for very long. And then you're lumbered with a drug that's going to cause quite a lot of havoc on your body. I'd like to conclude that ketamine may show some promise if used in very small doses on a medicinal use, but recreational use, although it may be appealing at the initial, it's actually quite a dangerous drug to get too friendly with, as it were. That's my take on ketamine. Thank you for listening.
I came across ketamine when I was introduced to the rave scene. I was offered a couple of bumps from a vial, and that's when I experienced my first K-hole. It took about 10 minutes to hit me. I saw myself just laying on the floor, staring at the ceiling, and the room felt like it was moving like a roller coaster, and there was no one around. I just felt numb. And then when it did finally end, I was sitting on the chair in the washroom just staring at myself. So I was having an out-of-body experience. And then coming out of the K-hole, it made me sick. But it went away after about like 20-30 minutes. And that's when I realized I liked this drug over other substances. When I was drinking, I would black out and have massive hangovers and would take the entire day to recover. And then with Ecstasy, the high would be for a few hours, but the come down and recovery time for me was like a day or two. But with ketamine, the come down and recovery wasn't so drastic. I enjoyed the feeling of numbness and not having to think, but still had control over my body. I was still able to work and live my life, and no one was able to really tell I was on ketamine. So now, let's fast forward to a couple of years. I had to do more to get the same effect. But the more I did, the more it was damaging my body. I just didn't realize it. Not until I started to get frequent UTIs. But these UTIs never went away. Multiple times I had to go to the hospital, and then the diagnoses were usually UTIs. Pee every like 10 to 15 minutes. It would burn. Barely any urine would come out. I started to wear an incontinence pad. That solved the washing problem, so obviously I continued using, which made the problems even worse. Carrying heavy things started to cause my bladder to hurt more, and I was sleeping with a heat pad every night because my lower back was starting to hurt. One morning I woke up and I couldn't even roll out of bed because the right side of my back was in excruciating pain. I decided to go to the hospital once again. They ran their tests and sent me home again with nothing. A few days later, the hospital called me and told me I had to come back and get antibiotics. Little did I know I was going to be admitted into the hospital for 3 weeks for a kidney infection. I was then referred to a urologist whom diagnosed me with the Ketamine-Induced Cystitis. The urologist told me the only thing he could do for me was to cauterize the bladder to stop the bleeding, but it was up to me to ketamine. There wasn't any medication that he could give me. There was a period of time when I did abstain from ketamine, and it took 6 months for my bladder to become back to normal. Ketamine users will live with these incontinence issues, continue using ketamine just to numb the pain, help until it gets really bad, like getting a kidney infection or kidney stones or going into kidney failure and getting dialysis.